So my name is Christine Derr, and I'm a lecturer here in the kinesiology department. I've been teaching health and wellness classes for probably about 18 years. And I also have a private practice as a marriage and family therapist. So I do that about 10 to 15 hours a week.
All right, cool. Did you want to share which graduate program that you went to for that?
Yeah, I grew up in Wisconsin, so I went to the University of Wisconsin-Madison for undergrad. And then when I graduated, I traveled for about a year and came back and did my master's at UW-Madison.
Were there any programs other than the one in Wisconsin that you thought you might want to go to, that you had to choose between?
At the time, I checked out a couple of private colleges, but I'm the first in my family to go to, I'm the only one in my family to go to college, so I was really limited by financial aid. Mm-hmm. And just the idea of moving someplace and setting up residency, that was just out of reach. So that's kind of how I landed there, but it was I love Madison, it was a great school.
Yeah. So some programs can be anywhere between like 2 and 4 years. How long was your program?
Mine was a 2-year master's program.
And did you have to take the GRE for that?
I did not. That was a bonus.
Were there any challenges that you faced when deciding to go to Madison, like you said, financial problems or the workload that you have to go through or anything like that?
In retrospect, I think I just always figured out how to overcome any challenges, and so I was always a little bit worried about the finances. I did have to take out student loans, and had student loans and paid them off over the course of 15 years, and so that was something that I was definitely worried about throughout the time. But the workload, I felt was fine, and I was always able to keep part-time jobs and work during the summer, so I was able to pay for a lot of it and ended up without huge student loans. Yeah. So the workload was fine. I think I just love to learn, and so I think I just dove into it. And I love psychology, and so that part was challenging, but in the retrospect, mostly easy, I guess. Yeah.
Do you feel that the workload that you had was appropriate for the program you were in? Because sometimes people feel like maybe they're gypped and just like getting their money taken.
Yeah, that's interesting, because as a teacher now, I'm always balancing. Is my class hard enough, challenging enough? How much work is too much? And I think being a student these days, the demands are different. The cost of school is very different. So again, I really feel like I got a good education given what it was. If I could go back again, I would probably look for a program that was more specifically clinical. And I got enough clinical training, but it really was, the program was divided between counseling and psychology. And so a lot of students who were wanting to become school counselors. And there were only a few staff who really had practices as therapists. So if I were to go back again, I would probably want a more strongly clinical focus per program. But I had no idea how to make those decisions back then, right? And that's where I think the advantage now is to be thinking even in undergrad, talking to people in the field and finding out how they did that. I think that's a great strategy.
Yeah. So how did you handle stress throughout your graduate program, whether it be applying to the programs, once you were in the program handling the workload, or going through your licensure process?
So I was in my early 20s when I was in graduate school, so I kind of have a vague memory of how I dealt with stress. And especially since I teach a lot about stress management and mindfulness, and I teach yoga now. I wish I practiced yoga back then. I think part of what I learned in my family was you just figure it out. And I didn't really have anybody that was helping me financially or socially or emotionally. I had friends, and I had a significant other by the time I was in graduate school, so he was a great help. But I didn't really have that financial support, and so I think growing up, I just learned just figure it out. Just do it, do what you gotta do. Don't complain, because nobody's listening. And so then I've had years of having to undo, being able to ask for help and being able to manage my stress in healthier ways. So back then, I think because I had to work a lot, and I just did what I needed to do. And now, over all these years, life takes its toll, and so I was drawn to yoga about 15 years ago, and I think that was because the stress of living here and adjusting to California as opposed to Wisconsin. Could I make it financially or not? I really didn't know for sure. And then over time, being able to balance, definitely being more of an introvert and doing extroverted things. So I think yoga was something that got me into meditation and mindfulness. So those are things that I think very much are just a part of my day-to-day, week-to-week managing my stress. And then I study and research a lot about stress. Like that's what I'd go back and I'd study if I were going back to graduate school, the psychoneurobiology of stress and reframing stress as a positive thing in our lives if you manage it well. So let's see what else. And you know, a huge way that I manage stress is that I take care of dogs. I've become very actively involved in rescue work. So about 10 years ago, I started taking in foster dogs. And so that's like the joy of my life is to have a house full of dogs. And they make me go out walking, or I feel guilty, so I walk them. And then get all the oxytocin because I get them up on the couch and we all just cuddle. And so that has really been an important part of me, you know, coming home and like having these creatures who have another chance, a second chance at life to love them up and they love me. And yeah. So good luck editing all that.
And so the last question would be, what is the best advice that you think you could give to someone looking to go into an MFT program or becoming an MFT?
Good question. So the advice that I would have for someone going into an MFT program would be to spend enough time in your undergrad to get some sense of what your interests are, and factors being equal, looking for a program that's really going to give you that earlier on, because then you'll be able to get into the, you know, whatever area of focus it is that you're hoping to get into. Sometimes I think some people realize, you know what, actually I do want to go on and get a doctorate because I might want to do research, or I might want to teach at an academic level in a tenure track kind of position. So that would be academically, like finding a program that was really interesting and going to meet your needs. And then the other piece would be just to continue to work on your own self-knowledge and self-care, because graduate school can be challenging, and so knowing yourself and knowing how to manage that before you get into that kind of a situation, that's just always going to be helpful.
All right. If you don't have any other final comments, we're done.
There's something else rattling here, something about, I don't know if this is helpful or not. One of the things I've learned over all these years is, I think myself and a lot of people who get into these kinds of helping professions, we often want to help, and knowing enough about being able to help to an extent and then seeing it as something offered and may or may not be taken. So I guess letting go of the outcome. You may or may not know that you can do some of your hours toward licensure. You can do some of your hours doing your own therapy, and I think it's up to 300 hours, and I highly recommend that. And I remember one of the people that I was working with for a while that person was getting their hours, one of the things that we talked about over and over again was, how do you not know what happens to them? How do you let go? And how do you not take it personally if they just stop coming? How do you feel like that you're not the right person to help this person and not feel like a failure and what I would say now is practice and checking your ego. That I think if you get really clear and clear over time about you're here to do what you can do, and then you can't save everybody, and you can only do a certain amount of the work. Somebody has to be there and be ready, and they may not be ready, or you might not be the right person. And so being able to be okay with that. I think that was something I really had to work with around the time that I started my private practice. I think I was really grappling with that. So that seems like something to say.